So this is a mission towards NEET PG 2025 to grab a very good rank, and we will learn few points every day. So let's start. Phospholipase A2 receptor is associated with, so that is associated with membranous glomerulonephritis. Okay, that is seen in elderly and it is having spike and dome pattern. Then dense deposit disease. So MPGN type 1 and type 2. Type 1 MPGN has tram track pattern. Type 2 has dense deposit disease. 2 is die. So dense deposit type 2. Emphysema associated with pneumothorax. Pneumothorax P. So P paraseptal or distal. Miliaria location CRP. Crystalline rubra profunda in that order. So it is the topmost layer, the lowermost layer, that is corneum, malpighian layer, then dermoepidermal junction in the order CRP. Medial medullary syndrome. It involves corticospinal tract, dorsal column, and hypoglossal nerve. Pondomedullary junction. The main cranial nerve is abducens. Thalamic nucleus. Anterior nucleus of thalamus to mammillary body. VA to basal ganglia. VL is cerebellum. Then VPL and VPM. VPL to limbs, from limbs, that is spinal lemniscus and medial lemniscus. VPM from mouth, that is from face, trigeminal lemniscus. Then constrictor muscles. Superior constrictor attachment to pharyngobasilar raphe, middle constrictor to hyoid, and inferior constrictor to larynx. Then transpyloric plane is T12. Joints, you have to remember mainly saddle joint, that is calcaneocuboid, then sternoclavicular, then malleoingus. These three are important. Corneal dystrophy, it can be lattice, it can be granular, it can be macular. So macula is mucopolysaccharide. Okay, then granular is like breadcrumb, hyaline deposit. Then lattice is amyloid. Then pre-core mutant versus chronic hepatitis B. So here you have to know what is pre-core mutant. Pre-core means there will be absent HBe antigen, and there is something called pre-escape S, that is HBs antigen is absent. Here pre-core HBe antigen is absent. Versus chronic hepatitis B. So here it is, the question was related to like something like infectivity. So in pre-core mutant, though there is no HBe antigen, HBV DNA can be high. The next transmission, you have to remember F, that is only one thing is happening in F, that is rat flea is only multiplying, that is propagative, and filaria only developing, cyclodevelopment. Both development and multiplying, cyclopropagative. Then the answer is M, malaria. HIV monoclonal ibalizumab. So the drugs in HIV, remember FEMI, fostemsavir, that is GP120, E for enfovertide GP41, then M maraviroc CCR5, and ibalizumab, that is again CD4. Then blood vessel around the femur. So it is, remember, it is in inferior gluteal artery. Superior gluteal artery does not involve, it is inferior gluteal artery, and also the branches from profunda femoris, that is lateral circumflex and medial circumflex femoral artery. Hyper and hypoechoic in MRI. So T1 hyper intense includes start from the skin, melanin, then fat, then protein substance, then gadolinium, and subacute blood products. Whereas hypoechoic in T1 and T2 is air, bone, calcium, ligament, tendon, and you remember ABC, air, bone, along with bone, tendon, ligament, then calcium. Then either it is flowing blood or chronic blood, that is hemosiderin. Then adduction, and it is not internal, external rotation. Adduction and internal rotation, it is posterior dislocation and all. Adduction and external rotation, this combination in a young child you have to remember. Two things. One is vascular necrosis, which is Perthes disease, and another thing is SCFE. So acute episode, that is Perthes avascular necrosis, whereas chronic, that is SCFE. Whereas in there is something called Tom Smith arthritis, the septic arthritis, which is abduction and abduction and internal rotation. This is ABER, it's not IR, ABER, and the other one was AD. This is ADER, abduction and internal rotation. Abduction. This adduction. So it is actually adduction and external rotation, ADER, okay, where usually it is ADIR, but here it is ADER, combination of two, Perthes avascular necrosis and one more, that is SCFE. Beta cells of pancreas is secreting insulin and amylin. Polypeptide is secreted from F cells. Genital TB. So you will be confused whether it is genital TB or PID. So in genital TB you will be getting a doughy consistency of the abdomen and all. Prussian blue is an antidote for thallium poisoning. A beta lipoproteinemia, there will be vacuolated cells in the biopsy picture, and there can be vitamin E deficiency, and it can be associated with cerebellar symptoms, and in blood you get Burr cells. Then next, non-dialysable drug, there will be elevated triglyceride also. Non-dialysable drug is mnemonic is avoid dialysis. A for amphetamine, verapamil, opioid, organophosphate, imipramine, diazepam, and digoxin. Bronchopulmonary dysplasia, if a preterm baby was born with respiratory distress and long-term mechanical ventilation or oxygen therapy, still the baby not improving, that is bronchopulmonary dysplasia. Infantile whiplash is other name for Cuffey syndrome, or it is called a battered baby syndrome. Post-exposure prophylaxis of anthrax, you are giving ciprofloxacin, either fluoroquinolone or tetracycline, doxycycline. Oppositional defiant disorder, then mnemonic is OCP. Oppositional defiant person is not damaging property and all. The child is a small child, only misbehaving, whereas conduct disorder is damaging property also. When it is more than 18, along with damaging property, it becomes personality disorder. Which personality disorder? Antisocial. Biliary atresia, the management is, it is ruined by hepatico-jejunostomy. Then most common complication of Whipple's operation, delayed gastric emptying. Legionnaires pneumonia, remember, it does not transmit from human to human. It can be a cause for ventilator associated pneumonia. Overcrowding, it is 50 to 70, 70 to plus 20, 90, 90 to 110, like that. And one room, 3 persons, 2 room. So 2 room, 3 persons plus 1, 3 room plus 1, 4 person, 4 room, 2 room plus 1, 3 person, 3 room plus 2, 5 person, 4 room plus 3, 7 person, 5 room plus 4, that is 9 or 10. Then cervical cancer, when to do chemoradiation, the total of 4 you should get. So either it is 2A2 or 3B1, and the rest of the things from 3B1, 3B2, all that up to bowel distant metastasis, that is 4B. Up to that it is chemoradiation only. A limited stenosis, it is Core's disease. you are getting limited stenosis, the deficiency of debranching enzyme, hematological changes in pregnancy. The unchanged is bleeding time and clotting time. Elevated is fibrinogen. All the clotting factors will be increased except only 11 and 13. Anti-clotting will be decreased. Protein C, protein S, antithrombin. Fibrinogen will be increased, so SR will be increased. Valley fever is coccidioid semitus. Desert rheumatism. Then damage control surgery stages, how many total? 5. One is patient selection. Immediately you are controlling bleeding contamination. Then you are putting in ICU. Then definitive surgery, abdominal closure. Then interscalene block is for shoulder dislocation correction. Triangle of doom. Which nerve is present? Genital branch of genitofemoral nerve, and it is going towards scrotum, the sensation of scrotum, cremasteric reflex. No, it is going for the sensation of scrotum. Sjogren syndrome. Sjogren syndrome is involved with CD4 T cell. BNS for sexual assault, 63. BNS 63 starts from 63 onwards. Then punishment. Then less than statutory rape and all. Then persistent vegetative state like that, 63, 64, 65, 66. Retinoblastoma, it can be in familial, it will be bilateral. Sporadic, it will be unilateral.